Hey everyone, welcome back to the channel. Today we're diving into a really important question. Are GLP-1 medications like Ozempic, Wegovy, Mounjaro, and Zepbound safe for older adults? These drugs can be life-changing, but for people over 60, there are some unique risks and precautions that doctors are urging everyone to understand. So in this video, I will break down the benefits, the risks that nobody talks about, why older adults need extra monitoring, and what experts recommend to stay safe, including how to protect your muscle and bone health. Let's get into it. GLP-1 medications exploded in popularity for diabetes and weight loss, and for good reason. Doctors like Chitra Gantra, a geriatrician at the Cleveland Clinic, have seen dramatic improvements in their patients' metabolic health. These drugs can lower blood sugar, support heart health, reduce inflammation, and promote significant weight loss. And with almost 40% of adults over age 60 classified as obese, the need for effective treatment is huge. Emerging research even suggests these drugs may help with dementia risk, addiction, and certain cancers, though we still need more long-term data, especially in older adults. Now, the good news is real, but so are the risks, and they're often much higher for people over 65. There's first and foremost, muscle loss, known as sarcopenia. Rapid weight loss means you don't just lose fat, you lose your muscle. Some studies suggest 40 to 60% of weight lost on GLP-1s may be lean mass, although results vary. Older adults already lose muscle with age, so additional muscle loss can lead to weakness, difficulty walking, loss of independence, higher risk of disability, nursing home admission, and even increased mortality. There's also bone loss, known as osteoporosis. Losing weight quickly in any way can reduce bone density. Less bone and less muscle equals major fall and fracture risk. One long-term study showed weight loss increased fracture risk by 39%. Third, dehydration and falls. Common GLP-1 side effects include nausea, vomiting, diarrhea, and constipation. For older adults, these can be more severe thanks to age-related changes in the gut. Dehydration leads to dizziness, fainting, and falls, one of the leading causes of injury in seniors. Number 4, kidney function risks. Dehydration can strain the kidneys and contribute to acute kidney injury, especially in adults who already have kidney issues. Fifth on the list, drug interactions, which is known as polypharmacy. Older adults often take multiple medications. Because GLP-1s slow digestion, other medications may stay in the body longer, or GI side effects can worsen. And finally, frailty and unintended weight loss. Doctors emphasize that in adults over 65, weight loss itself can increase mortality, especially if someone unintentionally loses more than 10% of their body weight. So for seniors, the goal isn't get the scale lower, it's preserve strength, mobility, and independence. Let's talk about what the experts are recommending. Doctors like Dr. Ganta and Dr. John Batsis agree on one thing. GLP-1s can help older adults, but only with careful management. You want to start low and go slow, the number one rule in geriatric medicine. Older adults often need lower starting doses, slower dose increases, and longer time between dose changes. This dramatically reduces GI side effects and dehydration risk. You also want to prioritize muscle and bone protection. Strength preserves independence, period. Essential strategies for this would be resistance training at least 2 times per week with 8 to 12 reps per exercise and 5 to 7 exercises. Include your legs, arms, core, and upper body, and you want to add weight or resistance bands as tolerated. Example exercises that doctors and physical therapists are recommending are sit to stand, squats, planks, heel raises, chair yoga, Pilates, water aerobics, and light weightlifting. Protein intake is non-negotiable. Older adults need more protein than younger people, about 1 to 1.2 grams per kilogram of body weight daily. Examples would be a palm-sized portion of chicken, fish, and tofu. You want to also eat nuts, seeds, and Greek yogurt to get that protein. And make sure you're getting protein at every meal and snack. Also keep in mind that hydration is critical, especially during dose increases, because seniors feel less thirst and they dehydrate faster. Consistent fluid intake is essential. You want to make sure that you're monitoring closely. Older adults on GLP-1s should have regular checkups of kidney function, hydration status, muscle strength, gait and mobility, bone density if you're at risk, overall frailty, and medication interactions. And finally, you do want to coordinate with your doctor. This includes reviewing all medications, deciding if weight loss is appropriate for you, setting realistic goals, function over the number on the scale. Many older adults care most about being able to get up from a chair, walk independently, play with their grandchildren, and avoid nursing home placement. GLP-1s should support these goals, not undermine them. So what is the future of GLP-1s in older adults? Even though the data in seniors is limited, especially over age 75, doctors are becoming more optimistic. But the big unanswered questions remain. Are the improvements due to the drug itself, or simply because people lose weight, they move more, and they reduce their inflammation? Do these drugs directly or indirectly reduce cancer or dementia risk? Researchers are actively studying this right now. GLP-1 medications can be safe and effective for older adults, but only with the right plan. The benefits are better blood sugar, reduced inflammation, improved heart health, and potential protection against some diseases. The risks are muscle and bone loss, falls and fractures, dehydration, kidney strain, and medication interactions. So what do? Start low and go slow. Prioritize the protein, strength train weekly, stay hydrated, and monitor closely with your doctor. Remember, for older adults, it's not about getting thin. It's about staying strong, mobile, and independent. If you found today's video to be helpful, please give the video a thumbs up. It really helps the channel. And if you want a follow-up video on how to preserve muscle while losing weight or how GLP-1s affect dementia risk, comment below and I'll make it happen. Thank you so much for watching today, and I'll see you in the next video.